Good morning and afternoon, everybody, depending what time zone you're in. Thank you very much for joining us for the webinar today. I'm going to just briefly review some of the key messages that came out of the Stroke Month report that Heart and Stroke released just a couple weeks ago. And hopefully many of you have seen. If not, you can see it on our website at heartandstroke.ca. So in the stroke report this year, we had a few key messages. One of them is that in this report, we really wanted to emphasize and increase awareness around across Canada and worldwide that stroke is not just a disease of the elderly. That stroke does happen at any age, and regardless of where you live and how old you are when you have a stroke, you have certain needs and certain recovery issues that may be specific to age or gender. So we really wanted to bring awareness to that. We wanted to get healthcare professionals and people working with people with stroke to really understand that, people who are developing community programs to really think about age, because a lot of our programs are designed for that traditional group and certainly still the bigger group of people over the age of 60 or 70. But we need to start thinking more about stroke in babies and children. We need to think about stroke because we know it's happening more and more in people in their 20s, 30s, 40s, and 50s. And then when you look at this diagram, it's a very meaningful diagram that acknowledges the different age ranges for people with stroke, the importance of families and caregivers in post-stroke recovery regardless of the age, but that the family issues may be different if it's a baby, because then you have first-time parents, versus somebody in their early adulthood, because then it may be a partner or spouse who's also trying to build a career, maybe involved in education. So different issues, and then certainly for the elderly, whether they still have a partner or a spouse who was the primary caregiver to the other person, which we often see, you know, when somebody has a stroke, but they were the primary caregiver to a partner who also has some health issues, that becomes a major issue. And we're also trying to emphasize the importance of, you know, you have your interactions when the event first happens with the healthcare system, and then many people will move back out to their community, either for support, resources, you know, things like home care or exercise programs, family physician care. And depending on the community you live in, those resources may vary considerably. And then you have to take in environmental factors such as where you live, what the socioeconomic status is there a lot of poverty, are you in a small rural town that's flying in only, or miles and miles, you know, hundreds of miles away from any kind of organized stroke services. So all of those things are very important, and we want to emphasize that in the report. What we know is that we're actually getting really good at the front end in treating stroke as an emergency and saving more lives than ever before. As a result, we know that there's well over 400,000 people living with stroke, and that at least half of those will need some sort of help after the stroke, but many aren't getting their needs met. And then the very big worry is that over the next 20 years, these numbers are expected to double, because it's still a disease as well as elderly, and our baby boomers are now between the ages of 53 and 71. So over the next few years, as they age even further, we will have a major issue with stroke on our hands. As we said, half the people who require stroke do need some help. It could vary between just help getting out to appointments or to do banking or grocery shopping, but it could also be help with the basics of feeding, eating, dressing, even just getting up and their mobility. And we really do not have those services in place for all people who need them. Another key message was that there's not just the physical disabilities that you may experience after stroke, but there's things you don't always see but have major impacts. Things like post-stroke fatigue, which is this really profound fatigue, even if you've rested, depression, aphasia, which is a communication issue, which happens to over a third of all stroke patients. And that really creates risk for social isolation, for not getting their needs met, and problems communicating what their needs are. So just to let you kind of look at this for a second, I won't read all of this, but these are some of our spokespeople from Stroke Month this year. Little Nolan, his mother, Laura Lenz, has been awesome. She's one of the co-leads for the Canadian Pediatric Stroke Support Association, which is a wonderful organization, and there's a link to it in our report. Alan Frew, who's the lead singer of Glass Tiger, his story has been very heartfelt as a celebrity, he's done a lot to help us raise awareness of stroke. A lot of celebrities I know who have major health issues will hide them and be afraid of how their public would respond to that. But Alan's been using his expertise and his fame to really help increase awareness and improve stroke care, and that's been awesome. And when we look at seniors, Lou Niebuhr has been a long-time supporter of heart and stroke and of stroke care, and a champion for stroke support organizations. Her and her husband Frank have really been so amazing. And so we highlight the stories of these people in the report this year to really make this a very human report and to really emphasize that we need to be looking at what those needs are and doing more to help support them. And so at this point, I'll turn it over to Maureen and Rebecca, who are going to look more into detail about what those needs are and what kind of supports may or may not be needed and available, and how you can be involved in your care. So thank you, and over to you, Maureen.
We can't hear you guys yet.
Hi, it's Maureen Markle-Reid. Thank you very much for the opportunity to present today, and we're really looking forward to hearing your comments and your feedback. So Rebecca and I are here today, and hopefully, see here.
There we go.
There. Can you see me okay? Alrighty. So we don't have any disclosures. Okay, so today's plan is what we want to talk about today.
We can't see your webcam, just so you know.
Okay, just a second. Okay, there.
Perfect.
Sorry.
Thank you.
Okay, so what we want to talk about today a little bit is about some practical tips with respect to your role in recovery after your stroke, to talk about self-management and some practical self-management strategies that can be used by stroke survivors and their families. And then Rebecca's going to talk about community resources and supports, and specifically how to get Heart and Stroke Foundation resources. So living with a stroke may mean coping with a number of disabilities, physical limitations. It might mean feeling anxious or depressed. And so the key for that is really to look at self-management. And what we're doing is defining self-management as what you do to live well after a stroke. So it includes not just developing confidence in terms of managing your medical conditions, but also being able to deal with some of these feelings that you experience post-stroke. So as an outcome, self-management means positive behaviors such as eating well, exercising, taking your medications, being able to monitor your health, and to be able to seek health care services appropriately. The process of self-management involves setting goals. It involves setting goals that are important to you as an individual, and then developing an action plan, identifying and anticipating and overcoming any barriers to carrying out that plan, and then to monitoring your progress on an ongoing basis. So when we look at self-management support, it really goes beyond patient education. It goes beyond learning the technical skills to manage your condition. And it's more of a systematic provision of both education as well as therapy to help improve your confidence and your skills to manage your own health concerns. So it's really important to have that ongoing conversation with your healthcare providers as well as your family members, and to be able to collaboratively set goals and problem solve together. That's really key. So this is a very complicated diagram that shows the process of adopting self-management behaviors. And there are really 5 key self-management skills that we're looking at. And one is around problem solving, being able to identify and solve problems, which is, we all encounter problems on an everyday basis, but it's developing skills to be able to address that in a very systematic way. Decision making, being able to access resources, and to develop a very good relationship with your providers. And you may have multiple providers. It may be your family physician, but it might mean other specialists or other community services, and then to take action. So the acquisition of these key skills are very important, because what they do is they enhance your confidence and your competence in yourself to actually achieve Outcomes such as being able to manage your medical conditions, to be able to manage some of the behaviors and feelings that you experience, such as feelings of depression and anxiety, and for you to be able to carry out your normal roles as a parent or a grandparent or a daughter or whatever that might be. So what's really key here is self-advocacy, and it's more about learning self-management skills as it is about self-advocacy and confidence. So we need to learn those technical skills, but we also need to develop the confidence and the competence in carrying out those skills. And then we need to try it out. And we need to learn from that and reflect on that and go back to the beginning. So it's really important that you advocate for yourself or your family members advocate for you, and that it's a real process that goes back and forth. So in terms of stroke, there are a number of topics that have been identified as key with respect to understanding how to manage your own care as a stroke survivor. So these are some of the topics, things like exercise, healthy eating, fatigue and sleep, learning how to identify and address some of your feelings and emotions after stroke. For example, feeling depressed, being able to identify and solve problems, understanding how to monitor your symptoms, understanding the risk factors, not just for stroke, but for other chronic conditions, and how to address those in a timely way to prevent the onset or worsening of other chronic conditions as well as another stroke. A big learning curve around medication use. Many people with stroke have many medications to manage, prescription medications, over-the-counter medications, and it can be very complicated, as well as changes in your memory and cognition that could have occurred after the stroke. So these are a lot of different topics that are important for you to address following the stroke. So as I mentioned before, there are 5 skills that are central to self-management, and these are the 5 skills that we've talked about earlier. And one of the key ones, I think, is forming a partnership with a healthcare provider. And that's not just regular contact with them, but that's really developing a very high-quality partnership where you feel comfortable with that individual and are comfortable in sharing and learning. So what we know about self-management support is that it's very important after stroke. And a number of studies have shown that people who self-manage well have better health outcomes, better quality of life, and a better ability to carry out their activities of daily living. However, there are a lot of different barriers to self-management that have been identified by people who've had a stroke. Things like not having enough support from healthcare providers, or the lack of communication or poor communication between stroke survivors and their providers. Limited access to community services and supports has been identified as a barrier. That could be due, for example, to not knowing what services are available, not being able to access services due to transportation issues or finances. That's certainly been an issue that's been identified. The lack of family support has also been identified as an issue. Having family support is really key to promoting self-management. Finances often act as a barrier, and certainly depression, pain, or difficulties with mobility are often problematic with respect to learning how to self-manage. Other barriers include having multiple chronic conditions. So it's likely that following stroke that many people have other chronic conditions, and they're often seeing multiple healthcare providers for those conditions. And as a result, maybe getting different information from different providers that could be conflicting. They could have multiple medications that have interactions, and the individual is not aware of what those interactions are. So there's a lot of issues with respect to having stroke plus multiple chronic conditions. Oftentimes the care that people are receiving is focused on their limitations and deficits rather than their strengths. And so it's really important as a stroke survivor to focus on those strengths and abilities and not to always look at your deficits. And certainly having difficulty understanding health information has also been identified as a barrier, and even getting information or access to information, what we call health literacy, is often an issue. So such as some tips in terms of what helps you succeed in self-managing. Well, the main tip really is that you are involved in your care, that you make decisions about your health, and that you, as an individual, have the choice to do that, and that you have a good understanding of your condition, that you're motivated and confident in your ability to self-manage and ready to change. So that means you have the conviction, actually, that the change is important, that it's important to make changes in your lifestyle, and you're confident that you have the ability to actually carry those out. It's important that you help develop and follow your health care plan and know how to problem solve or when to seek help, and not wait until the last moment to seek that type of help, and that you have the right kind of supports to meet your needs. Oftentimes people are receiving services and supports, but they may not necessarily meet your needs. And certainly having regular contact with your healthcare team is also a very key component, because improving your behavior in self-management is not just about education. It's about problem solving, it's about goal setting, it's about stress management. And self-management can be delivered in a number of different ways. So it can be delivered through a team. You might be involved in an educational session in a group-based setting. It might be one-on-one contact with your doctor or your nurse, or it might be both, depending on what is available to you. So what practical advice can I give? Just a few things to think about. One would be taking charge, along the same theme of taking charge of your health, is monitoring your own health, being proactive, attending the appointments that have been provided to you, developing a realistic action plan that can be achieved, and to try to prioritize your goals and not to try to tackle too much at once, because it becomes overwhelming. And when you're thinking about your action plan, you should be considering the pros and cons of different ways of carrying out your plan so that you can pick the action plan that has the most likely chance of succeeding. It's really important that you focus on your strengths and your abilities, not just your limitations. It's easy to always look at limitations and deficits and not look at your strengths. And it's important to look at the barriers that you're facing with respect to managing your own care and your recovery, and address them either on your own or in collaboration with your providers or your family caregiver. It's important for you to let your team know about your learning needs and preferences. People learn differently and have different preferences, and not everyone is ready to learn. And if it's not a good time, you need to be communicating that to your provider. And finally, it's very important for you to involve your family in developing and carrying out your plan of care. So finally, I think the important thing here is that there's a need to develop an equal partnership with your family caregivers, with your providers, to move forward and to take charge of your own health. So I'm going to turn this over now to Rebecca. Oh, sorry, I have one more slide. I thought I was done. Nope. So I just wanted to show you a study that we did that looked at self-management support using an interprofessional team approach to care. And this was completed in Toronto. And what we did was we compared the effects of a one-year team-based interprofessional team approach to community-based stroke rehabilitation to usual home care for stroke survivors. And what I'm just showing you on this slide is how the two approaches differed. So all of the participants received usual home care. But in usual home care at the time of the study, there was no interprofessional team. They had care coordination. They were providing services to stroke survivors, but it was very short-term and was provided primarily in the post-acute phase. There was some goal setting, but they weren't doing any kind of focus on strengths. And they also referred to health services. So what we did was we built on that in our intervention, and we formed an interprofessional team of home care providers who visited people regularly in their homes, as well as the team met and discussed each of the clients and provided care coordination over a one-year period. They also provided stroke education. There was a heavy focus on self-management, i.e. goal setting, prioritization of goals, action planning, and a heavy focus on strengths and abilities as opposed to needs and deficits. The focus was very heavily on patient and family-centered care, meaning that the patients and caregivers set their priorities for care as opposed to the providers. The emphasis was on health promotion and disease management as opposed to post-acute care. So we're looking at implementing strategies to address risks for stroke as well as other chronic conditions, and of course referring people to services as needed. And what we found was that those stroke survivors that received the interprofessional team approach demonstrated greater improvement in their quality of life, specifically physical functioning and social functioning, compared to those that received usual home care. And we actually looked at the cost of providing both ways of services, and we found that those improvements were obtained at no additional cost. So it didn't cost any more to provide this team approach compared to usual home care.
Great, thanks Maureen.
Okay.
So I'm going to speak to you a little bit now about some tools and resources that can help support your long-term stroke recovery and really pull in some of those key principles that Maureen has spoken to us about with regards to self-management. So one of the programs I wanted to quickly mention, I'm not going to get into too much detail because Luis is going to speak to this in more detail during his slides, but I did want to make reference to the Living with Stroke program. So this is a self-management education program that was created through the Heart and Stroke Foundation. And essentially what it is an 8-module program. They can run from 6 to 8 weeks. There's a facilitator or co-facilitator model. And essentially it brings together a group of persons post-stroke. Sometimes family members join, but it really is intended to review some of these key education topics, and these you'll see correlate with some of the key topics that Maureen mentioned that are critical for persons post-stroke to learn about to support their self-management. And in addition to the education, there's this weekly goal setting, action planning, and really there's some accountability and peer support that runs through that program. So just something I want to mention, and you absolutely can see where there may be a local course offered through the Heart and Stroke Foundation website. Sorry, I hit the wrong thing. I'll try. Another excellent resource that I wanted to bring to your attention, also created through Heart and Stroke Foundation, is a very comprehensive guide called Your Stroke Journey. And this is a guide for people living with stroke. It takes you through every single aspect of stroke recovery, right from out of the gates and understanding the stroke and what might have happened in your brain, to all of those different issues that you may be dealing with throughout the continuum of your recovery. It is an extremely comprehensive guide. You can download it and print it off for free off the Heart and Stroke Foundation website. And again, highly recommend this as an additional tool to help you with your recovery. So another thing I wanted to talk to you about is making the link to why exercise is a really important part of your recovery. So there's great evidence that demonstrates that after someone's had a stroke, they often will have low levels of cardiovascular fitness. And we heard Patty refer earlier to how many persons after stroke do experience a limited ability to complete their activities of daily living. So what can happen with this is over time it can lead to further physical deconditioning, further sedentary lifestyle, and then it really begins this cycle of an even greater reduction in fitness levels. And this can worsen disability, it can increase the risk of stroke, and so really just wanted to emphasize that exercise and aerobic fitness, it really is an important part of your recovery. It's something that you need to have assessed with one of your healthcare professionals that knows your medical status. They need to be able to provide you with some clear recommendations around physical activity, what would be healthy for you. But it's something important to absolutely build into your day-to-day life. This can help break that cycle and start to reduce your risk and increase your quality of life and your daily functioning. So this is a nice figure that I really like that sort of pulls together how fitness really relates with function. So you can see here along the bottom part of the graph is a lot of your typical activities of daily living. And along the left side you'll see METS. And those are METs, and what those are is the energy requirements required to complete these activities of daily living. And so in the general population, most of us have the energy that we need to complete these activities without taxing our cardiovascular system. But what you can see with this red line here is that after a stroke, your energy levels or your METs are decreased significantly. So if you look across that red line, you can see that, yes, there may be the energy to complete some of the activities on the left side of the graph, but there isn't enough energy for most persons post-stroke to complete some of those activities on the right side. And so again, this is just helping to build that case of building in aerobic exercise and fitness under the advisement of your healthcare professionals into your day-to-day life, because that can raise the bar in terms of your energy and your ability to complete the day-to-day activities. So just really wanted to make that link. And so one way that you can build exercise and physical activity into your life is through a community-based exercise program. And there are some great community-based exercise programs that have been created specifically for persons post-stroke. So I just wanted to speak to you a little bit about that. I'm going to start off with the Fit for Function program because this is a research study that I have been and continue to be involved in. And essentially, we had conducted a pilot study, this is back in 2011, but looking at comparing the effects of a 12-week exercise and self-management education program of persons living in the community after stroke to a standard 12-week YMCA membership. So we had 61 participants in the pilot. Those that were randomized to the intervention group essentially participated in this Fit for Function program, and it was a 12-week formal program. The staff delivering the program had been trained in terms of creating and progressing people that had had a stroke. So 2 days of the week, participants attended a task-oriented functional group exercise class. And then 1 day of the week, they did a very stroke-specific individualized exercise program and participated in the Living with Stroke self-management education program. Those participants that were randomized to the control group essentially got a 12-week free YMCA membership that could entail up to 7 sessions with a wellness coach. They could end up going 7 days a week, 1 day a week. It was really up to the participants' discretion. And what we found is that those people that participated in the Fit for Function group demonstrated greater improvement with community reintegration, with balance, with lower limb function and mobility. And they were able to maintain these benefits at 24 weeks. So this allowed us to apply for further funding, and there's another trial underway right now. We received funding through the Canadian Institutes of Health Research to do a multi-site randomized controlled trial of Fit for Function. So that's underway right now, and we've expanded the Fit for Function program to YMCAs at the Hamilton Downtown, in Niagara, and in Brantford. So stay tuned for those results. So a working group out of the Ontario Stroke Network came together and created this really helpful exercise guideline. This is a post-stroke community-based exercise guideline. It is intended for certain exercise providers in the community. So if you're living in a community that doesn't yet offer a community-based exercise program tailored specifically for someone post-stroke, you may want to go onto the Ontario Stroke Network website and pull these guidelines. You may have a rec center or a local fitness trainer or someone that might be interested in offering this type of programming in your local community if it's not offered yet. And these guidelines provide a very comprehensive, detailed way of how to safely offer post-stroke community-based exercise programs. Another excellent resource that was created for persons post-stroke and their family members is how aerobic activity can help you after a stroke. So this just provides a little bit more detail in terms of aerobic exercise. What are some of the important things to consider as you look at building this into your life and your stroke recovery? And then I just wanted to mention a few other evidence-based exercise programs that have been designed specifically for persons post-stroke that might be offered in your community. So I already mentioned Fit for Function. There's also Together in Movement and Exercise, the TIME program, as well as the Fitness and Mobility Exercise, or the FAME program. So absolutely look to see if these types of programs are offered in your community. So another important component of your long-term recovery and reintegrating back into your community is around peer support. And there is a Canadian best practice recommendation that really emphasizes that persons post-stroke and their family members should have access to peers who have had experience in terms of stroke recovery and transition and can help the person better understand this transition. So there were interviews that were conducted as part of the research to support this recommendation, and really these interviews with stroke survivors and their caregivers revealed this need for immediate peer support, more individualized and hopeful care, and help navigating the healthcare system. So a great resource to explore if there are peer support programs in your local community is through March of Dimes Canada, Stroke Recovery Canada. It's a national service that offers support, education, and community programming, and they will connect you with a network of support. So it may just be that you're seeking more information, it may be that you want to get their newsletter, or it may be that you want to get or start your own peer support group in your local community. So this is just a warm line that you can call and absolutely get connected. And then finally, there is this additional great resource that Stroke Recovery Canada created, a caregiver's guide to stroke recovery. So another excellent resource that you can find online. Again, I would highly emphasize that you look at the Heart and Stroke website, at Stroke Recovery Canada website, your local health authority or LIN, Local Health Integration Network websites, your hospital websites. These are places where you'll be able to see if there is peer support programs. Some hospitals and areas have peers fostering hope, peers supporting peers. So there are a lot of resources out there, and so these are just sort of some avenues for you to seek that out. So I'll turn that over to Luis now.
So hello, my name is Luis Rivas. I am a stroke survivor and a living with a stroke facilitator. And in this part of the presentation, I would like to share with you a few things that I learned, or should I say I am learning, in my stroke journey. Before I start, I have to say that I have no conflict of interest to declare at this moment. And getting into the subject of my journey, it started one day in April 2011 with a hemorrhagic stroke I suffered caused by high blood pressure. At that time I was 37, I was healthy, or so I thought, because I didn't know that I suffered hypertension. It took me around 1 year to go through all the rehab centers and hospitalizations. And during that year, during that time, I realized how lucky I was that day in April. That was the first day of my new life, but it could have been very easily the end of my life. I could have died very easily that day. So I decided that that was worth celebrating. So every April 8th in the last 6 years, I have bought a cake, put candles, and sing cumpleaños feliz, which is happy birthday in Spanish. And at the end of the year, I found myself with my affected left side. My arm was not moving as it is not moving now. My leg was just partially recovered, enough to let me walk, which is very important for my independence. And I also had lost all the peripheral vision on my left side, which doesn't bother me much as I'm not trying to do things like driving. During that year, I spent most of the time working on my recovery, but I also used the waiting time in between centers to finish my studies of PhD that was ongoing before the stroke. And I remember that moment because the time where I was ready to defend my PhD was also the time of my last visit in therapy, which happened, as I said, roughly 1 year after the stroke. Then later I learned about the Living with a Stroke program, which I did as a participant, and it has such a positive, good impact on me that I decided that I needed to stay involved with it, so I became a facilitator shortly after. My stroke journey, and I'm sure that many of the survivors in the audience will agree with me, it's a very difficult journey and it's full of emotion. There is a lot of sadness, there is a lot of fear, there is a lot of anger, frustration, but there's also room for hope, serenity, even joy. Looking back at those early stages of my journey, I remember 2 very scary moments. The first one happened when I was put into the ambulance because I didn't know what was going on with me. I didn't know what a stroke was. I didn't know even the word stroke. So I was inside an ambulance going to the unknown. I only knew that there was something very wrong with me, and possibly my life was on the line, because you don't get to ride in the ambulance just for the fun of it. And then the second scary moment, maybe it's not that obvious, it's the last day in rehab. For me, it happened when my occupational therapist came to me one day and said, "Hey, Mr. Rivas, I think you are ready. There's not much we can do for you at this moment, so you can now go and get on with your life. Good luck and enjoy your life." And that was a very scary moment, because at that time we have to face a lot of small things, usual things that we do in our lives every day, like getting dressed or cooking, moving around, doing the grocery, even our hobbies, which were things that didn't require much energy, as we have heard a moment ago, or we didn't need to plan, and now it's a challenge that we need to plan for. We have to get ready for them. And it's true that we have tested, tried, and trained all those things in the therapy, but in therapy, it's a very safe environment. If something goes wrong, our therapist is around, and there are a lot of other physios and nurses and doctors that will come in a matter of seconds to get us out of the problem and out of any danger. But now we are at home. We might be even alone doing any of those things. And if something goes wrong, then it's our turn to get out of our mess and try to stay safe. So it's quite a challenge and a scary thought once you get in the face of them and you realize how dangerous they might be. So the first key idea that I want to share with you today is, when we are asked what do we want to get after the stroke, I think we all say we want to get back to normal. And that normal usually means to do the same things we used to do before the stroke, in the same way that we were used to do. But maybe that makes no sense at all. For me, I realized that my body had changed. The way I interact with my environment has changed. So it made no sense at all to try to do the things in the same way I used to do, just simply because my body has changed. So our goal should not be go back to normal, the same normal that was before the stroke, but it should rather be to define the new normal. Our goal should be do things. We might need more time. We might need new tools. We might need to find new techniques to do the things, but our goal should be go back to doing things. And in some way forget about how things were before the stroke, because it might make no sense in our new reality. There are two key ideas in this process of defining and relearning, and those are independence and self-management. We have already heard about self-management, and a few things that I learned about this is that it is okay to ask for help. There's no problem with that, especially when we are facing something new, a new challenge, something that we have not already figured out, and we might get stuck and not know where to continue or which is the better strategy to go over that challenge. So it is okay to ask for help. What is not okay is to keep on asking help and become dependent if we are able to do the things ourselves. Of course, it's easier if there's somebody else who takes care of things. It requires less energy from our side. But if we can do the things, we should try and do them ourselves. We have to fight for our independence, because if we don't, we lose it, and we are losing a very important part of our life. And this comment is also for the caregivers, because I can imagine how hard it must be for a caregiver to see your survivor struggling with some very simple tasks. So there is the temptation of jump in and get things and do them easily. But if you do that all the time, you are not only not helping the survivor, you are also preventing us from improvement. We need that struggle, we need that work to learn about ourselves, and that brings me to my next point. It is okay, and I would say it is very okay, to try and fail, because that leads to learning. If we fail when we are trying to do something, we learn something about the task we are trying to do, and we might even learn a few new things about ourselves. So the next time we try, we will do better and we'll have better chances of succeeding. So try things and failing is not a problem. The problem becomes when we just give up without trying. That happens to me in a few occasions when I was trying to do something and I look at my arm and I saw my arm just staying here on my lap, and I said, no way, there's no way I can do this. So I just give up. And if we do that, we are giving up a small piece of our life. And that is something that we do not want to do, because we have been lucky enough to survive. We can not let that go in small pieces along the way. So trying, it's a key point, but just one last advice: whatever you try, security should come first, because if we add an injury over an already limited abilities to do things, we are going back a few squares in this journey, and that makes things even more difficult as they already are. So whatever you try, remember, be safe. Now I want to share with you a few images on how my new normal looks like now. On the left of each image, you have my old way of doing things, and on the right side of the images, you can see my new way of doing things. And there are things simple and common as cooking or cutting my food, working or taking notes, and also some hobbies and some of my favorite activities that includes reading, knitting, and one of my favorite ones, video gaming. And so the journey continues, and here I want to share maybe the second key idea that I have found in these past 6 years, and it's that the road of recovery, in this road of recovery, doctors, nurses, and therapists are like our GPS, showing us the best routes and telling us you can go this way and turn here and try this thing, and then go this other way and try these other things. But it is always up to us, the survivors, to fuel that car, to put that energy and move forward, and of course drive. And we are the ultimate, have to make the ultimate decision of where we want to go and which way we want to take to go there. So whenever we find a challenge, my recommendation is to do some research. I would recommend, and I usually do this, to go online and look up for whatever our challenge or our goal is. You will be amazed of how many things are already out there that can be helpful. And just also be imaginative, because maybe what we found is not exactly what we want to. We need to adjust, or we need to change a few things to get to the final solution that will help us to achieve our goals. But also remember to keep a critical spirit. There are a lot of good things out there, but there are also some weird stuff. And sometimes we can even come up with a crazy idea on how we can do something, but we might always keep the doubt of, will this be good for me? Is this really helpful? So whenever you are unsure of what you want to try and do, just check with your doctors and therapists. Communication, as we have heard before, is key in this point. And then they will happily give you some advice and maybe tell you, no, you shouldn't try this product because that will affect your blood pressure medication. Or the therapist might say, if you try to do that in that way, imagine that this breaks and then you will be in deep trouble and you can hurt yourself. So why don't you try this other way or something different? And when you feel that you are ready and you are safe, just try to do the thing and try to achieve your goal. You have to be proactive. You have to be the fuel of your car in the journey. So don't hesitate, try. And don't, as I said before, don't be afraid of failure, because if you try and get the failure as a learning process, it's a win-win situation. If you succeed, congratulations, you have done it. If you fail, you are learning. Next time you try, you will have a better chance to do it. So it's a win-win. I would like to share a few more resources that are available. As I have said, I did the Living with Stroke program as a participant, and it had a huge impact on me. Doctors and therapists and nurses, they can give us a lot of very good advice, but there is also another piece of advice that can be very useful for us, and it's the advice from someone who is in the same journey as us, from a fellow survivor. Living with a stroke works because it's a group of survivors and caregivers that meet 6 to 8 weeks, depending on the format of the program, and we share experiences about relevant topics. We have seen them in a previous slide. And we can get advice from the people in a similar situation. And this is very important because we get to learn from the experience of others that can really understand what we're going through, because they are going through the same kind of situation. When we share a story and we say how tired I am, or I feel frustration or sadness, they know all those feelings because they have gone through them. And the fact that we share these experiences with people that really understand us is very fulfilling, and it's a very positive feedback that we receive. And if we share our stories with them, it creates a bond within the group that increases the positive spirit, and we learn and we move forward together. It's very important because when we are a survivor, we have the tendency to isolate. And this is very bad. We get the feeling of being alone and nobody understands what we are going through. And that's not true. When we get in a room with other survivors, you can see that they are going through the same kind of problems that you are, and you get this sense of community. There is another source of resources online. If you go to Facebook, you can find a lot of videos of babies and playing with kittens and puppies and all these kind of cute things. But there are also groups that can be very helpful. And I would like to highlight a Facebook group organized by the Heart and Stroke Foundation. It's called Community of Survivors. If you get in Facebook and you look up for Community of Survivors, it will pop up. And I think that in our audience, there are a few members of the community. If so, hello guys. And in this community, you will find survivors like you, and you get a safe environment to share your stories. Again, it's the same principle of getting in contact with other survivors that really understand what you're going through, and they have probably tried things that you are ongoing now, and you can learn from them, and you can refine and have a better strategies to achieve your goals. So I absolutely recommend going into Facebook and look for this group. There are some others, and you can check them. So if you do with a community of survivors, you can send a request for joining the group. Then just follow the process and you will get to the group. And if you do, don't forget, don't be shy and say hello. I'm sure that many of the members already will answer you and say hello, and you will feel that you are part of the community. And this is all that I wanted to share with you today. I hope that my experience will help you in your journey. And just thank you for your time, and good luck and enjoy your journey. Thank you.
Thank you very much, Luis and Maureen and Rebecca, for your great presentations. If people do have questions, please send them through the question chat box and we will address them. We do have a couple of questions, so we'll get going. I just want to start with Maureen and Rebecca. Maureen, you had mentioned that communication with healthcare team is a barrier Do you have any recommendations on how to overcome that?
So I think it's important that people feel have a provider that they feel comfortable with. And that might be your family physician, or it might be your physiotherapist, your occupational therapist. So I guess that's the most important thing is developing a really good relationship and a rapport with a healthcare provider that you trust and that you feel you can connect with. And with respect to accessibility, sometimes it's difficult to get there, get to the appointment or whatever. So there might be ways in which you can address that. There might be transportation challenges. It might be a financial issue. And so I think it's important to talk to your providers about those issues and try to problem solve through some of those areas.
And from a tools and resources standpoint, what I would recommend would be twofold. So first and foremost would be the your stroke recovery journey resource that I mentioned before. It has tips all the way throughout, like starting in acute care and inpatient rehab, if that's part of your journey, what kinds of questions you should be asking at the family meeting, what kinds of questions you should be asking the physician and your team members. It also takes you through to some of the things in terms of questions or resources you could be seeking through your family doctor. There's a link to a post-stroke checklist, and this is really intended to be a checklist for family physicians in terms of really paying attention and understanding what are some of the key components in terms of long-term stroke recovery, but it's absolutely a very valuable resource for persons after stroke and their family members as well. So those are just some helpful tools, I think, that can also help guide some of the questions you might want to ask and some of the areas of stroke recovery that you want to make sure are getting addressed.
Great, thanks. And in regards to an action plan, is there some type of way you would put that together, or is there a resource that kind of guides you through being able to do that at all?
So sometimes it's a little overwhelming after a stroke because there's so much to deal with, and I think it's maybe important for people to even just make a list of some of the issues they're facing, and then to share that list with their provider and talk about where, how they feel, and to try to break it down into smaller goals, and then to prioritize those goals, and then to tackle something that that you feel is achievable, and work together with your provider to develop a realistic action plan, and for you to take the ownership of that action plan and for you to define how that's going to play out. It's not the providers that are going to tell you what your goals and action plans are, but rather that's going to come from you. So I liked what Louis said about the healthcare providers are a GPS, because they're there to help to coach and support you, but they're not there to tell you what to do. It's up to you to define your own goals and objectives and your own plan that works for you.
And if you are able to participate in a Living with Stroke program, what's excellent about that resource, and Louise can maybe speak a little bit more to it, but it actually, I think it's in module 1 or 2, where they actually review how to set proper goals in terms of being realistic and manageable. And then as you work your way through the Living with Stroke program, after each module or learning topic, you're really intended to set goals around that topic. So if it's around nutrition, then as a group you really should try to set a proper, realistic, measurable goal around nutrition, and then come together as a group to see if you were able to do that that week. I don't know, Louise, if you have anything else to add? You're on mute.
Oh, we can't hear you, Louise.
Okay, yes. So I was saying it's a very powerful tool. The goal setting process is an exercise that it's done throughout. It starts on week 2. We sometimes in our group started in week 1, so we have 1 more week to train. And it's a simple set of rules on how to set a good goal that is realistic, that is affordable, that you can do. And it's how to set, because as you said before, you can get lost in getting a goal and you can go crazy and have a very unrealistic goal. And it's a way to break it into small pieces, as Dr. Markle-Reid said. And each of those pieces should be realistic and should be a good goal that you get to achieve in, let's say, 1 week. So during the program, we do that. Each week we set a goal, we explain how to do these good goals, and each one of the participants is invited to set a goal for themselves. And then as a group, we review if that goal is really a good, smart goal. And then we get that week to work on it. And then on the next week as a group, we review each one if we have achieved the goal, and if we haven't, why haven't we? And then we come up with strategies how to, improve your chances. As I said, if you fail, it's not a bad thing because you get to learn. And in the next time you try, you have a better chance to succeed.
That's great. Thank you very much. And Luis, you may have already touched upon this, but as a Living with Stroke facilitator, what do you find is like the most helpful for people that you're working with? Is it the action plan and the goal, setting the strategies and so forth, or is there some other recommendations that you have with your firsthand experience as being a Living with Stroke facilitator?
I think that the aspect where you get the most out of the group is the feeling that you are not alone, and that you get to learn from others, and your experience helps others, because whatever your experience was, if it was important for you, it might be important for somebody else. And the fact that you get to share with some peers, survivors, it gets a positive environment, and we all, let's say, suck from that positiveness, and we give the positive spirit into each other, and we grow together as a group, not feeling alone. So I would say that that's where the magic of the Living with a Stroke happens.
And just to give a few more examples from some of the groups that I've facilitated is right along with what Luis is saying. I recall one person, their goal was to call someone on the phone. They had aphasia and were finding that they were too intimidated to make phone calls. So their goal was to call one of their family members, but all the other participants offered to share their phone number, and he practiced on them first. Mm-hmm. So he sort of called each one of them a day and then called the family member at the end of the week. And similar for the physical activity, some of them actually got together, and if their joint goal was to, walk around the block 3 times a week, some of them got together to do that. So I echo Luis's point about that peer support in terms of supporting each other achieve those goals.
Okay, and thanks very much for that. And just to let you know as well that if you don't have access to the Living with Stroke program, there is the Facebook Community of Survivors group that Luis had mentioned as well, and so you can connect with peers that way and have a few conversations with people that may be going through the same thing as you. So we will provide a recording, as mentioned, along with a survey, and people have asked for a list of resources, so we will try to put that together and send that out as well in the follow-up email that we send. Again, I want to thank all of our speakers today for taking the time to put together their presentations and deliver them. A lot of great conversation happening, and we look forward to delivering more of these webinars, and connect with us through Facebook. Thanks very much, everyone, and have a great day.
Thank you.
Thank you.
Thank you.